Self-harming or mutilating behavior can prove to be fatal, and it doesn't prove fatal in a lot of cases, but still it's an ongoing process, and you have to assess the severity of the behavior in the individuals. We've already discussed the different methods that have been devised to basically categorize the disease in the milder forms, in the moderate forms, or in the severe forms, but it's not always the case. There is a continuous assessment that has to be done in that particular patient. Then when you have a patient at your hand of deliberate self-harm, you have to keep in mind that he's suffering from this particular kind of behavior. The risk factors are basically concluded in that particular case, ranging from the history taking. Obviously, the interviewing and the history taking is the mainstay over here. A complete and a detailed history is taken. Then a collateral history is taken from the parents and from the friends and the family if they're available. So if he's suffering from some sort of a personality disorder, for example, the obsessive compulsive disorders, he may be suffering from the mood affective bipolar disorders, the schizophrenia, schizoaffective disorders can lead to hallucinal states. Hallucinations can be of tactile, visual, or auditory type, and there can also be the delusions in his minds. So when we define delusions, they are basically the firm thoughts that are kept in the mind of that person. They can be the delusions of paranoia, and then they can be delusions of persecution. So all of these make the life of that particular person quite difficult. Basically, he or she needs help to get them out of that particular situation in which they feel relief when they harm themselves or they want to end up their lives. So the questionnaire is again over there, in which you basically get to know the thought form and the thought content of that particular person. The leading thoughts would be pessimistic. There'll be delusions of persecution. There'll be delusions of paranoia seen in the thought content of the person. Then the plans or the suicidal attempt are also dug out when you're interviewing that particular patient. So the self-harm behavior on its own is an incident, and when you have it in your OPDs or when you have it in your emergency departments, depending upon the severity of the incident, you have to investigate that particular event. You have to even document that particular event, because it would be really helpful for the further references in the life of that person. If he comes up again with that similar history of deliberate self-harm, you will have that record that he had a previous attempt of suicide or a previous attempt of deliberate self-harm in his or her life or not. So that is again going to be quite helpful in the management of the cases. In this particular section, we'll be focusing on the interviewing of the patient particularly. So as I've already focused on the fact that there's going to be quite a good patient-doctor rapport, because that is going to lead towards a complete investigation of that particular patient. Had there been any stressful life events in the life of that particular person? Has he or she been suffering from any kind of a sexual abuse or any kind of a domestic abuse? It's again going to reveal, or is again going to basically conclude into that deliberate self-harm behavior. The relationship problems are again going to be seen in such individuals. These individuals may or may not be suffering from personality disorder, from some sort of organic disorders, even terminal illnesses, or even the mental state examination. It can even be a mini mental state examination, or even a complete detailed mental state examination should be carried out in such individuals. So it should be a wait and watch phenomena that should be done in these particular individuals. They should get hospitalized if the necessity is felt by the physician or by the psychiatrist, and a complete investigation should be carried out, ranging from the general physical examination, the vitals of that particular individual, all of these investigations, the blood CPs, the LFTs, all of these investigations should be carried out in that particular individual. And then the investigation of the crime scene, or the investigation of that incident, is again very important. What circumstances were there that led to this deliberate self-harm incident is what you're going to find out. The outcomes are again different in different cases depending upon the risk factors and depending upon the comorbidities that the person is suffering. So the treatment modalities will be the same, ranging from the pharmacotherapies to the CBTs, that is the cognitive behavioral therapies. But of course, the outcomes can be same depending upon all of these risk factors and the comorbidities. If he's suffering from any kind of a terminal illness, all of these organic factors can be seen in such individuals as well. So the difficulties of this deliberate self-harm are that the patient is usually under the influence of drugs and alcohol, and they're quite irritable. So the interviewing phenomena is quite comprehensive. It's basically, you cannot usually comprehend such individuals if they are drug addicts or if they are in a state of behavioral problems due to the withdrawal. So it's again going to make the interview very difficult, and you cannot get to the facts or the thought content of that person. So these patients are usually unhappy to be found alive. So these are the different outcomes after the deliberate self-harm attempt. He may be unhappy to be found alive, or the distressing and the conflicting emotions are sometimes seen in a lot of individuals. They're usually reluctant to speak about that incident. They do not want to give you the details to that incident, how it occurred, what were the methods devised for that deliberate self-harm. So these are the difficulties that make it very difficult for the clinician and the psychiatrist to get to those circumstances which led to such kind of a deliberate self-harm incident. Usually these patients cannot make eye contact and they're quite agitated. So it's all of these factors basically make the interviewing process quite difficult with the patient. So you have to get on these hindrances, and then only you can get to a complete conclusion and to a complete management plan. The precursor events in the life of the person can be the argument with a partner, the argument with a parent, or the cumulative thought. So usually you'll get to have a lot of incidents in which there is no previous history of deliberate self-harm, or it was a single episode of argument with a sibling, with a parent, or with a partner, and that led to this kind of deliberate self-harm event or this parasuicidal event that took place in the life of that person. Then cumulative thoughts can be seen in the thought form or the thought content of that particular individual as well. When we are investigating the incident itself, we have to get on to the thought content. A lot of questions can be put forward. They have to be the open-ended questions. Whether the patient was unaware of the results or not. Sometimes the drugs are taken, sometimes the medications are taken, and the patient is not aware of the fact that it is going to prove fatal for that person. So that would not fall into that category. That would fall into the category of the accidental criteria. There can be the serious attempts that may not coincide with the nature of the attempt as well. And then we can have the leaving a note phenomena. So usually if the person was about to commit suicide, he's going to leave a note. That will indicate that basically he was not harming himself. It was not an accident. He deliberately harmed himself. So after the self-harm, you're going to basically assess the patient whether he's regretting the incident or not, whether he's distressed by the failure of the outcome or not, or whether he is in an anger or hostility. So these are the phenomena that you're going to assess in a particular patient, and that is going to basically finalize whether he's getting hospitalized or getting the further treatment for the counselings and the pharmacotherapies or not. A good risk assessment should be performed in these individuals as well. So basically in this section, we described that after the incident has taken place, how can you get on to the precursors of the incident, and how can you get on to the further treatment modalities of that particular person. So that is the end of this section. Thank you for watching sqadia.com.